I'm so delighted to be here today again. It's been more weeks than normal because the Mighty was switching up some scheduling, and unfortunately, I'm a clinical psychologist, and I've been in practice for over 25 years. I got my training in Dallas, Texas, at UT Southwestern. Actually, that's a medical school. It's a really cool place to get training. But anyway, my husband and I moved here to Fayetteville, Arkansas, back in 1993, and I started my practice here then. So me and the Mighty found each other about 4 years ago. They were kind enough to allow me to start talking about something that I now have out about a book out about, which is Perfectly Hidden Depression, and, I was so delighted to be invited, and then they turned around and invited me back to just sort of be a regular host if it worked out, and it has. So I'm on usually monthly, usually the 3rd Wednesday of the month, and I think we'll probably go back to that in September. No, I guess in August. So, um, I'm just delighted you're here. You can find me at drmargaretrutherford.com. That's my website. I also have a podcast called the Self-Work Podcast with Dr. Margaret Rutherford, and I'm on Instagram. I have my own Facebook page, and you can certainly join me there, where I post my own stuff, but also other stuff that I find interesting. So let's get to what we're talking about today. We're going to talk about anger and how you use anger productively. The only thing that I want to make sure, or try to make sure, that we don't devolve or dissolve, however you wanna say it, into a place where you talk about what is making you angry. That's not the content that I really want to do here on a mental health side. In mental health, we're focusing on changing the process of things and you learning how to grow some skills that maybe because you have depression or anxiety or bipolar disorder or whatever it happens to be, that you do struggle with anger, or maybe you struggle with withdrawal and you're avoiding anger. A lot of people do that, I promise you. So, we're here to talk about 8 well, I'm really gonna I'm gonna use an article that I found in Psych Central and one in Psychology Today that I kind of connected and put the information together. We're gonna talk about 8 important things about anger to help you begin to understand maybe what's going wrong with your own communications about anger, but also how you can begin to change it into anger that's actually productive. You know, Anger has something to do with our values. Anger is not in and of itself a bad or negative emotion. Sometimes the expression of anger, or what we choose, or what we're very impulsive enough to do um, with our anger, is what the problem is. So that's what we're going to be focusing on today on Mental Health on the Mighty. And hello, I'm beginning to see some people. Jody and Emily. Hi, Emily. You really helped me a lot. Thank you so much. I love this. The host, Camera, and I were talking about how long that I've been doing this. And um, y'all are very special to me. You're a very special audience to me. And I'm very honored to be here with you. Hi, Laura. Okay, let's talk about that, Laura. Let me go through these 8 things. Hold on, let me look. Now listen, I'm so angry. I'm so sorry. So I feel human again. I'm non-med compliant, and after 4 months, I've come off my meds. I'm now riddled with guilt. Any help would be great. Okay, well, you know what? Let's talk about this, Laura. Um, it sounds like the diagnosis itself is really somehow off-putting to you. And bipolar illness is interesting because it has been not normalized. Actually, it's sort of the diagnosis of the decade. "Oh, she's so bipolar," or "I'm so bipolar." And it used to be borderline, or OCD is the same way. I'm just so OCD. Codependent is another one. And people throw those words around like they're not real struggles in someone's life. And so I think some of the anger could come from feeling like you're being stigmatized by actually putting a label on it. Um, obviously, you are self-sabotaging because of some of that anger, but let me reassure you that you're far from the first person, nor will you be the last person to receive some sort of diagnosis like that and then struggle to accept it. I have panic disorder, and I can remember going from therapist to therapist to therapist, asking to get rid of my panic. And when they, one, they didn't help me do that, but two, one finally said to me, "That's not the direction you want to go." And I said, "What do you mean?" And he said, "You having panic disorder is just as much a part of you as the things you don't mind other people knowing. And so, if you can really self accept, if you can understand that there are things that are part of a diagnosis that can actually be helpful to you." For example, people, when we're going to talk about this, people with bipolar disorder, one of the best things they can do is figure out what your triggers are because, and lack of sleep is one of those usually. So, I think sitting with a diagnosis, go into therapy one time and say, "I'm just so mad that someone's labeled me like that. I'm not a thing." I was in the hospital one time for rotator cuff surgery, and I remember overheard a nurse say, "Oh, she's the rotator cuff in bed 8." And I thought, "I'm not the rotator cuff in bed 8, I'm Margaret." And so the nurse came in and I said, "By the way, my name is Margaret, and yes, I'm about to have rotator cuff surgery." So maybe your anger is also about, I don't wanna be bipolar. I don't want all of that to I don't want that label to tell me or suggest that that's now I'm fitting into a s a s I'm fitting into some rubric that somebody wants me to fit into, okay? So, maybe that will be helpful, and it's okay to be angry, but not to self-sabotage because there are definitely things that can be very helpful for people with bipolar disorder, okay? Alright, and now, of course, anger and agitation are also part of sometimes hypomania, so that gives it a whole 'nother aspect to it that's important to adopt or important to understand. Well, gosh, these are great. I have all this stuff prepared, but these are great questions. So, wow, how do you get over anger when your psychiatrist doesn't think you need a med change, but I feel I do? Well, Brittany, um, he or she is not the only psychiatrist in the world. I think you just flat out say, "Well, I'm gonna go for a second opinion." And if your gut and your experience with managing your own illness is telling you either, "I think I'm overly sedated," or "I'm overly excited," or "I'm sleeping too much," or "My mind is too foggy," you know, your psychiatrist is not in your head. Now, there also can be very pragmatic reasons people wanna go off medications. They've gained weight. They've, some of the other ones I just noticed or noted, things like foggy thinking or whatever. So I'm not a medical doctor. I'm a psychologist, so it's important I not give medical advice. But I don't think it's medical advice to say to someone, if you don't think that your provider is giving you an adequate reason for not wanting to change your medication. For example, if he or she says, "Well, there's some things in your medical history that really this is the best one, and let's either up this or let's lower it and see if that works." If they're not giving you an adequate explanation for why they're not responding to your request, then, go for a second opinion. And I if they get defensive, then there's a problem with them. Okay, Stephen. The biggest reason I get angry is when my family members don't respect me, like not listening when I say no, or respect my boundaries, like coming into my home without knocking, woo, or letting me know they are coming. This is Stephen and Ann. Okay, so sorry, I forgot I left off the in the Ann part. Um, yeah, that's not good. Um, a lot of there's a concept in psychology called enmeshment, and what it basically means is that the family is it's like an enmeshed family and boundaries are not really respected. It can go from really a mild case to where, maybe you're your family asks you questions that you think are a little inappropriate, or you're having a struggle kind of growing up and developing your own identity away from your family. But it also can go to quite severe where you grow up in a family where they literally tell you the only people you can trust in life is our family, where there's even a sense of the world is a distrustful place. So this not without and coming in without knocking or letting you know they're coming, that is a sign that they're just not seeing you as either sort of having your own life away from them or developing your own life with your spouse. So, I think you have to talk about it. And actually, we're going to talk now about these 8 important things about anger, and maybe they will help you. I don't know if this is Anne or Stephen, whichever one was asking me about that. So, okay. So the first is that anger is about information. It's about your values. It's about what you care about. I got into this profession because I volunteered at the domestic violence shelter in Dallas. And I actually was in an abusive relationship myself, which of course I was discounting. But thank the powers that be that I started volunteering over there because all of a sudden my awareness of abuse shot out of shot up like a rocket. But I overcompensated in some ways, and I would see someone in the grocery store speaking rudely to their spouse, and I would, wanna go over there and grab their hair or shake them and say, "Don't do that." I was overly sensitized to the possibility of abuse. So, but it also said your values are changing and what you think is important in life is changing, and you're growing and changing, and so, um, it really helps you know when it's time to intervene. I like that word because intervention is productive. Lighting into somebody, and which we're going to talk about, but you want to intervene when you realize you're angry about something. So in this instance, you want to intervene with your family saying, oh, yeah, we can just walk right on in. We don't really care what's going on. You also want to talk about um, okay, so that's one is information. Two is it's important to intervene and to understand what's happening in your body when you feel angry. And what happens sometimes, I know when I get angry, I get this way of kind of my chest closes up, and I know my eyes get really intense. And so if I recognize that's happening, I can decide to back off because I know what I'm about to say is probably not going to be productive. And those sensations can help you step back and detach a little bit. So it's information. You then begin to assess those sensations. The number three is what's the root of the problem? What's underneath? Often like to ask people if you're not so angry about it, what other feelings do you have? Because a lot of us are more comfortable with anger. Some people are not comfortable with anger at all. But there are people who are so comfortable with anger that they shift every emotion into that channel. And so you want to understand what is the root of your anger. I think in this particular example, you not feeling respected because they're not respecting your boundaries is a very clear one. But it also might be the same thing happened when you were a child that, your boundaries weren't, I mean, maybe it's a very old feeling in you and that, or maybe you were abused and you certainly that's your boundaries are not being respected. So it might have roots in something even more painful. Okay. You might have had an experience like you confided in a best friend and she or he told your peer group, and so your boundaries weren't respected, and you want to try to understand what's underneath because often, it's kind of like if you just cut off a weed and you don't pull it up by its roots, then it just will come back. Okay. Number four, I love this one. It says just because you feel something doesn't mean it's true. Some things make me angry, like maybe I'm trying to get to work quickly and I see all these cars really going slowly in front of me, and I think, "Oh, what in the heck? I I need to get to work." And then I'll realize it's a funeral procession because I have to go right by a cemetery. So, it's about, "Oh, wait, I was feeling angry, but I don't wanna be angry. I need to just calm myself down and be patient and realize if I'm 2 minutes late, that's okay. So sometimes we get angry. Now that's a very simple example, but this can often happen in depression, for example. If you feel something, then you can decide that it's real. So we can feel angry and decide, "Well, I have a really good reason to be angry," but do you really? And how do you wanna express it? Number 5 is, again, kind of do some thinking about how you feel about being angry. Um, I've certainly gotten angry at times when I've realized it was foolish or I was embarrassed by my anger. I was, I think sometimes when you get angry, you can you can justify it and think, "Well, anybody would be angry in this situation." But again, do you really know that? I did a podcast last week, on mental mistakes and cognitive distortions that we say, and they really stress cognitive behavioral therapists really stress that sometimes you can justify feeling something and then you build it up like, "Yeah, sure, this is right. This is fact," when again, it is not. Number 7 is to get clarity. Um, oh, no, sorry, number 6 is learning how to calm down quickly, and there's some wonderful techniques that are called grounding techniques, where you breathe and you like, I'm sitting in a chair right now with some pillows behind my back. If I really, if I think about the weight on my chair, if I think about the pillows, um, I'm hearing my voice in this microphone, which is a new setup for me. I hope y'all are liking it. Um, I feel the air on my skin, it's kind of cool because I've got the air conditioning on. If you really close your eyes and begin to ground yourself, then you can calm down, okay? Stay in the present. Finally, number 7 is to get clarity, um, and that's kind of what I was talking about before about how you feel about being angry. You want to not justify your anger. Your anger may be very justifiable, but sometimes you need to check it out with other people, or sometimes you need to stop and say, "Okay, I'm angry, but how do I want to express it?" And this is what the eighth one is about: is expressing yourself respectfully. And this I take straight from DBT, which is dialectical behavior therapy. And it's from Dear Man. There's uh, a it's a technique called Dear Man to help people, again, with just this sort of respectful communication. The D, so DEAR, the D is to describe the facts you've noticed. For example, not you wouldn't say again, someone wrote in and said their family just comes in without knocking, so that's what I'm talking about if you're just getting on. So you would say, "I notice that you don't knock when you come to my door. That's a fact." And they'll go, "Yeah, what about it?" Okay? Then you express your feelings using I language. "Well, I feel like that's not as respectful as I'd like for us to be with one another, and sometimes it even makes me angry, and I really like to talk about it with you." I. The A is assess what you'd need or like. What I'd like is for y'all to, just give me a text before you decide you're gonna drop by, or I'd like you to knock on the door. I keep it open. But I just really wanna make sure that I'm not, busy doing something else, or maybe I'm wrapping your birthday present for all you know. I would like this is what I'd like, and you say it in a respectful way. And then the R is to reinforce how your request will help or benefit others. And this would mean, I think our relationship will be so much better with this kind of respect, and I'll give it to you. And then I think once we do this, that we'll both have a sense of respect for one another. So D stands for describe facts. E, express your feelings using I language. A, assert what you need or like that's different. And then R is to reinforce how your request will help everybody. Now, this doesn't always go completely smoothly, obviously, but it's an attempt. Okay. Um, some people who like to be angry may, when you just ask nicely or respectfully something, they may escalate and tell you, you've obviously been to your therapist again because that's crazy, or something like that. Okay. So let's get back to your questions. Thank you, Maha. Maha? Anyway, it's a lovely name. Thank you. I like the I think you're talking about the explanation about bipolar. So, okay, Bryn, I wish I could get a second opinion. I've been on a cocktail of meds that finally was helping my issues after plenty of switching and then lost insurance due to divorce after 15 years. That's something else that's really hard. And the VA refuses to prescribe the same meds and even same dosages or the ones they would prescribe. I'm not sure I understand the last part. I'm a 100% disabled veteran and can't even get the meds I know work for me. Even more infuriating is that my psychiatrist works for the VA but also has his own private practice. Wow. Yeah, I've never worked in the VA system, but I've had patients who have come to me, and we have a VA hospital here in Fayetteville, Arkansas, where I live. And sometimes they're describing really wonderful treatment, and then sometimes the VA is overworked, or certainly there are some insurance companies that will, or, and I'm sure the federal insurance company is one of those, federal insurance, that they will not cover certain medications unless, you've really tried one and then you failed on it. I don't know if that's the issue, um, but that's very for example, I have a patient yesterday, however, who's on Seroquel, and now she's beginning to get tardive dyskinesia, and all it works for her as far as her psychosis is concerned, but obviously with the tardive dyskinesia, she's having, some problems, and then she's also got diabetes, so she's gonna have to switch to something else. But that is, difficult, um, and if you can't switch, then at least you can say, again, as respectfully, like we just talked about, as you can say, "I'm not really sure that I don't you may be trying, but I don't feel listened to or heard about this medication, and I'm trying to handle a divorce, and I just really would appreciate you tuning in. I have a heart issue, and I had to and, oh gosh, I was so nervous because I get nervous with this kind of assertiveness as well. This woman has a wonderful reputation, and a cardiologist, and I actually chose her because I observed when she told a friend of mine that her husband had died, and I thought she did it with great, great sincerity and comfort and caring. But I wasn't having that great a relationship with her, and I think the part I claimed that was mine was I don't have a traditional cardiology issue, and so it feels a little like I'm scared I'm not gonna be believed, so I'm more anxious. But anyway, finally one day I had to say to her, "I just don't think you're listening to what I'm saying to you." And she didn't particularly care for it, but then we talked through it, and she said, "Well, I can see from some of these specific examples you've given me how you might feel that way." And it was an uncomfortable conversation, but she tunes into me now. I feel really tuned into. So sometimes those kinds of times to choose to be assertive respectfully can be very helpful. Okay, great. How does one remove the roots from the weeds, as you say? Hey, hey, Tate Arthur. Um, well, that's a great question. You know, um, there are a lot of workbooks on working through anger, I did my books on perfectionism, and there are several um, workbooks you can get about, the 15 steps or the 35 steps or to rid yourself of your perfectionism. And I'm sure those books are good. I'm not knocking the books themselves. I'm sure they're well thought out and very helpful to many. But as a clinician for over 25 years, I'm relatively certain that if you don't know the why of something, if you don't know where in your either childhood or in an earlier relationship, or maybe even what we're discovering now is that there are intergenerational legacies of anxiety and depression that can be just almost absorbed by family members that are younger. For example, if you have a great grandfather or great grandmother that was, you know, uh, captured by the Nazis or something, that kind of trauma can actually be passed down from generation to generation. So, knowing the why of something can be really, really help you be more clear, help you realize what your triggers are, help you realize, why your anger may be as intense as it is, so that you can learn how to manage it, know where it's coming from. What I always say to people is a huge clue that something has some as a root in your childhood or in some sort of trauma, whether that be trauma that happened to you or what's this intergenerational trauma, is that you either have an overreaction to it or an underreaction to it. Meaning, if I were yelled at a lot, if I had been yelled at a lot as a child and really emotionally abused in that way, I could I could have 2 different reactions. I'm let's say I choose someone who also yells at me and I take it. I'm underreacting to it because it just feels familiar. Or I made up my mind when I was a child that I would never be yelled at again, and I'd always be in control, and someone even raises their voice around me and I overreact. So, because of the same history, but the how you dealt with it is different. So you can have an overreaction or an underreaction. I think that's a really simple way of trying to figure that out. And, you know, y- it's a little hard to do that self-guided, but there are ways to do that. And look for authors that really try to explain the why and don't just I mean, yes, if you've listened to me before, you know that I'm a firm believer that you get your hope when you're changing your behavior. But insight can also be helpful. Insight gives context, okay? Wonderful questions today. Claire, and what as above, so below, or I don't know, I don't know how if that's really your last name or whatever. It's cool. I'm a recovering addict and relapsed again recently, but back on track. Good for you. I know that I'm disappointing my family and angering them, and I'm angry about my relapse and angry for my family. But our resentments beget anger, you're right, and the cycle is vicious. How can I help my own anger with myself? And how can my family work through their anger and pain they feel? Gosh, what goes around comes around sometimes. I just answered a question. I answer a listener email every week on my podcast, and this man had written in that, yeah, he actually, it doesn't matter. He contacted me. Sorry, too much detail, TMI. And he said, that he has COPD, he has liver disease, he has um, other things. There were several things wrong, and he knew it. He knew he was at fault, but at the same time, his wife was saying he was just feeling sorry for himself. So they were. So I talked a lot, and I don't talk a lot about addiction. I'm not an addictionologist, but it was a pretty clear case that they were just really angry with each other, and he was shaming himself. So what I would say to you, Claire, is that are you really angry or are you stuck in shame? And, you're beginning to think your relapse has defined you as a person. An awful person because I relapsed. And, you're a good person, you're a strong person, and you relapsed. And so that doesn't define you any more than however long you spent sober. As far as your family is concerned, I mean, I think if you shame yourself and remain angry with yourself, then you're more open to their anger because all of a sudden they're saying, you go, I know I'm angry. And so, yeah, just heap it on. Rather than saying to them, I want to listen to what you're angry about and your disappointment in me, but we need to move on so that, and I will take responsibility for it, but I can't let you shame me for it. We all need to move on. Maybe they don't know how to talk about their fear. One of the things that's very true, at least the people that I've worked with, when someone relapses, they may get angry, but they also get really scared because they don't know. They may have convinced themselves, for example, that, um, well, she'll never relapse, or they don't understand the model of recovery well enough. And so they get scared, but they don't know how to talk about their fear. Fear is a lot harder to talk about than anger. So they're staying angry. Um, you can ask them to join you with your therapist if you are in, or I don't know if sponsors would do that, but you could, just try to think of it more in a systemic way, but, if you're stuck in shame, then that's gonna give them, you're giving them a lot of space to remain angry with you. Okay, I hope I got that straight in my own thinking. Okay, Amy Marie, how do I go about talking to my doctor about upping my dose? Well, this is kind of a medical question. I mean, basically, you say, um I did better on the larger dose. Now, if it's a benzodiazepine or something that can cause addiction, again, I'm not an MD, but they may say, "I just can't give you that much. I'm afraid," they maybe have some addiction qualities to it. I don't know. But, you don't certainly feel free to say to them, "I just don't feel as stable," or whatever, and maybe y'all can come up with a different solution. Sarah Catherine. My mother, 61, has been living with my 32 oh, your 32-year-old husband, I guess. No. Oh, with you and you're 32 and your husband 34 for 5 years now, because she was supposed to live with us for just a year or 2 until she could get back on her feet. There's no end in sight with her being able to support herself and live on her own. I love her, but I feel like I've tried everything, and sometimes I just get so frustrated that she's not been taking the time to figure everything out. Okay. Well, your mother may be making some assumptions. I don't know, but it sounds like there's not a lot of clarity, and maybe you've been scared because you are growing more resentful, um, and that's what happens when boundaries and anger are not discussed because you just can seethe. That word seethe, you can just seethe and become very resentful, and then maybe act in passive aggressive ways, meaning you're trying to get your point across without actually saying, I'm growing more and more uncomfortable with this. And so it may be that you could go to even a family therapist and someone who's used to seeing more than one person at a time and say, listen, we've got this issue in my family and I'm a little scared to talk to my mom about it, or I'm growing in my anger. Or, um, there's a wonderful book called The Dance of Anger by Harriet Lerner. And gosh, I read the book so long ago, I can barely remember it, but I know it's been revised several times since, because she wrote it a long time ago. But it also helps, especially women, figure out what they're doing with their anger, where they are either avoiding it, or she has all kinds of great examples in the book. But resentment will really only hurt you. And it may be that you and your husband need to come up with a strategy yourselves to suggest to your mother. Say, okay, kind of like when you're wanting change in your children, you say, okay, and we'll give you a week to do this and 3 weeks to do that, and then by blah, blah, blah date, then you'll have this down, or you'll be on your own. You'll be I don't know what it is. You can do that with your mom and say, "What do you think's a fair amount of time for you? And this is what we've come up with, but what do you think is a fair amount of time for you to remain living with us?" And she may say, "Oh, I thought everything was just fine." And then you say, "No." And so that's may be shocking to her, or it may not be. But, come up with a timeline and say, "We'd really like to move toward this, and does this seem fair?" And then you stick with it. You stick with it. And of course, when it's a parent, that's hard to do. But anyway, good luck with that, and I hope that brings some clarity. Cassandra, what can be done with envy and anger? I'm often angry at my husband, sometimes myself, for not having characteristics that I like in other people. And then I'm angry at myself for being so petty. We've been married for 5 years and overall have a great relationship. Shame plays a part in this. What a fantastic question. Okay, so you've been married 5 years. I have a little theory about what happens somewhere between 5 and 7 years. I mean, there's a reason why we have a 7-year itch, okay? what I really see and felt in my own marriage is that right about that time, you realize that those things that kind of irritated you or you were a little disappointed in, you thought might change. Either you thought, "Oh, well, that's just his or her immaturity," or that's, he or she will probably stop doing that, or gosh, if I love him or her enough, they won't do that anymore, um, which is not the case. But basically, we can get stuck thinking about those things. And one of the things when I'm working with a couple, I will say to them is I'll hand them a couple of yellow pads and say, write out the major way you think you disappoint your partner, maybe 2 or 3 of them. And they'll kinda look surprised, and I'll say, "Oh, you know them. You know what disappoints your partner." So they kinda go, "Well, yeah, it feels weird to write about it." And then, you trade those lists or you talk about them, and sometimes it can be kind of funny because you realize, yeah, my partner knows what I'm putting up with and vice versa. But then the important point is to do this. If I know something disappoints my partner, then I've got to realize that that is a gift that they give me. They give me the gift of tolerance of their irritation or their disappointment, and it's up to me to not, push or take advantage or manipulate that tolerance. How many times as a marital therapist have I heard, "Well, he or she knew this when we got married." Well, yeah, but living with it on a day-to-day basis and then having children with that person is it changes the whole, dynamic and the whole temperature of the relationship. So, um I think it's important to try to have open discussions about what you're tolerating and, um, and, yeah, so that you can still allow those things that you really love about them to be what's primary in you. And then if you do feel like they're manipulating or taking advantage of your tolerance, you have to tell them about it. Okay, okay, all right. Okay, so these are some of the same people. Do we have any another question. Okay, Stephen and Ann. My sister-in-law was very aggressive with me while my husband didn't do anything to stand up for me. Is it wrong to be angry with him for standing up? Yeah, he didn't stand up for you. We do have an amazing relationship, but he never stands up for me against his family. Okay. Well, I like to ask myself this question. What do I know about my partner that would help explain this issue I have with them about and what I'm disappointed in? For example, my own husband doesn't really he's better after 30 years, but he really doesn't like to talk about emotional pain. He grew up in a family that they just didn't ever do it. They, in fact, denied its presence, and so why but he married a psychologist, interestingly enough. So, you know, um, so sometimes I run into that, and I feel kind of lonely because I am, recognizing that I have something I'd really love to talk to him about, and I may try, and he may try, but it's just he's got some baby skills, but he's not really adept at it. Um, and so that's okay for me to be disappointed about that. I knew it coming into the marriage. It's been a little harder to live with, and he has his share of things as well that have been harder to live with about me. So I think that if you realize you're both, you wanna give that gift of toleration and at the same time you're also receiving it, then that's an important balance. Okay? Cassandra, thank you. Sharice, hi. Great. Let's talk a little bit about I wanna go back to my list, and I wanna talk a little bit about impulse control. So, really, good anger management in fact, this particular article, which was a different one, talked about how the typical anger management stuff you read is basically sort of based in the 1970s and is really outdated. So, I grew up in the 1970s, and I certainly remember some of the things that were going on there, and it's all sort of flowers in your hair and, all that stuff. So, a lot of those lists are outdated, and I think now in the 21st century, we wanna talk more about impulse control, especially with texting and all that kind of thing. So, again, you want to look for what is triggering you. We've talked a lot about that today. And then what is your impulse to do? What actually, again, sort of what do you feel in your body that makes you just suddenly wanna like, you get a text that makes you angry, right? Or they don't text you back for more hours or minutes or seconds than you think they need to, okay? So, you get angry. Where do you feel that in your body? Sometimes you get hot or you feel tension or you'll sigh a lot or, you think of revenge. Next time he texts me or she texts me, I won't text them back and see how it makes them feel. And so it becomes you really want to understand that you're having this reaction by getting angry and but that's not always what you wanna do. I another question I like for my folks to and I myself to ask this is what I'm about to do, is it more likely to create chaos or create good communication? If it's chaos, maybe not a great thing to do, right? So, you know, they don't text you back, you think about it, you text them back, say, "Hey, haven't heard from you." Sort of expected, again, thinking about that dear man thing, to describe the way you're feeling, to express your feelings respectfully. I'm using I language to then assert what you would like to have happen, and then to reinforce how that would help your relationship. So it's DEAR. So that's another example of where DEAR is important, okay, to help with impulse control. Then this article also talked about you deciding whether you're an anger dumper or you're an anger withholder. And what anger dumpers mean to do that they just dump it on you. They'll say, "I just don't have a filter and I get angry. I just can't help myself when I get angry." Well, yes, you can. And, you just have to not dump. You have to stop and delay and get in the present and then decide, what do I want to do with this anger? Is this going to create chaos or good communication? And then the withholders, you're avoiders, you're withholding, you're pulling your anger in, right? So what you really want to do is to make sure that you stay in the present. You don't like anger. Anger is hard to talk about. You'll say to things yourself like, "Oh, if we get angry, we'll never get over it." Um, that's not the case with healthy relationships, at least. You can be angry with one another and then still very much want the relationship to continue. So if you're an anger withdrawer, then you need to try to stay with the present and figure out what value is your anger trying to lead you to. Okay, so one more question. How can you handle anger when it is rooted in becoming disabled, like I'm not the best version of myself and feel like I'm a burden? Oh my goodness. Hmm, wonderful question. A painful question to hear. I have a blogger friend slash acquaintance. We've only truly met once, I think, but she has MS and she writes openly sometimes. I mean, her name is Kathy Chester, and she has had MS for a long time. And she writes a lot about being angry and having ideas about who she could have been, what her life would have been like if she did not have MS. And yet, she also writes about she might be somebody that would really be good for you to tune into. She also writes a lot about how she could be the best version of herself given what has happened to her. Probably the most painful kind of therapy I've ever done is with parents who've lost a child. It's even worse if it's to suicide, but it's just horrible. You can't even imagine your life going on. You don't want it to go on in many instances. And I think when there's healing around that certain circumstance and painful event, these are the people who realize that they can either let that event kill them as well, or that loss, that tragedy can be something that they begin to use to help them make the best life they can out of what they've been given. It doesn't mean it's fair. It doesn't mean that it was meant to be. It's just what's given to you. And so, I would encourage you to try to read some things from other people who are dealing with chronic disability and trying to understand and learn from them about how to turn your anger about it into something that's more motivating than destructive. Guys, I so appreciate you being here. Again, there are lots of ways of tuning in to who I am and where I am. I hope y'all liked this new setup. It's sort of official looking, isn't it? Anyway, the sound is better and my internet connection is better, so I'm hoping that it's gonna lead to a more positive experience for everybody here on the Mighty. I'm Dr. Margaret Rutherford. My podcast is the Self Work Podcast with Dr. Margaret Rutherford. My website is drmargaretrutherford.com. My book is Perfectly Hidden Depression: How to Break Free from the Perfectionism That Masks Your Depression. And in that book, there are over 60 exercises that are meant to help you figure out not just what to do about it, but the why of it, pulling out those roots. It's hard work. Um, I got a critical review from someone on Goodreads that said, "I loved the first 3 chapters of this book, but then it kinda turned, like, into a therapy session." And I was like, "Yep, that's right." So, I wanted to be now, if you have severe trauma in your life, I would never recommend working through severe trauma by yourself. I just wouldn't. It's too difficult. But if you've if you think you have things in your life that you really are trying to work through, the exercises in the book actually pertain to anyone. So you can use those, and it's cheap. It's like less than $12 on Amazon or something like that, and even less for the Kindle or the ebook or the audiobook. Anyway, so if you're interested in perfectionism and depression or just keeping your, you know, being somebody who can't ever, that who basically someone whose shame rules their life, then this book may be for you. And I have been honored to write it. It kind of found me. So anyway, I was delighted to be here. Thank you, Camera and Mental Health on the Mighty, for being here. Thank you all for asking questions and comments. I'll see you in September, whatever the third Wednesday of the month, and it'll be back at 3 p.m., I think, rather than 1 p.m., 3 p.m. Central Standard Time. So I will look forward to seeing you there. I'm not sure what the topic will be, but we'll come up with something that will hopefully be very helpful. If you'd like to suggest to me what topic you'd like to hear, you can also email me at askdrmargaret@drmargaretrutherford.com. Thanks so much, and goodbye for now.